For many people, the smile is the first thing to attract you to a person. No one wants to befriend someone with stinky breath and yellow teeth. Gum disease is very preventable and unlikely if you have good oral hygiene. From mouthwash bottles, TV commercials, information about gum disease is everywhere. For the next few minutes, I will be informing you about gum disease. First, I will explain what gum disease is, the causes of gum disease, and its signs and symptoms. Second, I will tell you how it is diagnosed and how it's treated. Finally, I will explain how gum disease can contribute to more serious, dangerous diseases. I will start by telling you about gum disease, what causes it, and also signs and symptoms. In the early stages, gum disease is referred to as gingivitis. Its middle stages, periodontal disease, and its late stages, acute necrotizing ulcerative gingivitis, also known as ANOG. The gum disease gingivitis is inflammation of the gums due to plaque caused by bacteria and a lack of oral hygiene. According to TheraBreath, 85% of adults who have gum disease, they're mostly unaware of the fact. People who smoke or chew tobacco have a greater chance of getting a periodontal disease because it all starts with the buildup of plaque. Poor hygiene is the main cause of gingivitis. The bacteria buildup causes plaque, which irritates gum and starts to infect them, causing inflammation. Genes can also play a role in your oral health. If your family history consists of tooth loss, you can have a greater chance of developing a periodontal disease. If this is the case, be extra careful in caring for your gums. It's very simple to do so. And gingivitis is also very simple to diagnose. The first sign is usually red bleeding gums, and pain and swelling is another sign of gingivitis. The same procedures are done on a patient to diagnose gingivitis as well as someone with ANOG, although ANOG is a much more serious stage of gum disease. Majority of the cases are diagnosed without further examination other than the signs and symptoms. If signs and symptoms of gum disease are dominant, your doctor will refer you to a dentist. The dentist administers a periodontal test. If the groove between the teeth and the gum is bigger than what the probe suggests, that's a sign of gum disease. In some cases, the dentist will administer an x-ray to see what condition the jawbone and teeth are in, but that's if it's kind of serious. And in its early stages, gingivitis can be mostly self-treated by over-the-counter medicines or prescriptions. Having good oral hygiene can eliminate signs and symptoms of gingivitis fairly quickly. Brushing at least 2 times a day, flossing at least once, and using mouthwash. Buying an over-the-counter antiseptic mouth rinse like chlorhexidine or hexadine can help you too. Used once a day for about a month, it helps eliminate bacteria. And seeing a dentist is sometimes necessary to get rid of the disease if you reach the stage of ANOG. Sometimes getting a thorough teeth cleaning can rid you of gingivitis. It all kind of depends on the case. And in more serious cases, antibiotics like metronidazole and doxycycline are prescribed to get rid of the disease. Now that you know what gingivitis is and a little bit about it, I will tell you how it can cause further health problems other places than just your mouth. Gingivitis can in fact be easily prevented and cured, but if responsibility isn't taken of the situation, some much more diseases can occur. Cardiovascular disease, respiratory diseases, Alzheimer's diseases, type 2 diabetes, blood clots and strokes, and even can cause premature and low birth weights of your children. This can all be eliminated by simply educating your loved ones on just how important brushing your teeth can be. It could ultimately save their lives from a very serious disease. For the last few minutes, I told you all about gum disease, how it could contribute to contracting some other very serious diseases. It is one of the most simple things to get up and brush your teeth. It should be like a second nature. After meals, before bed, or even if your breath is feeling funky, go refresh. It doesn't only make your mouth cleaner, but it makes you more confident and most of all, healthier. Doing something so small as forgetting to brush your teeth could cause huge health problems down the road. No one likes them when they're rotten, so don't let your teeth be forgotten.